is Health 54 right here on your Digital First Pan-African News Network, TOS Television. I am Rose Audu. Scientists have found evidence of a resistant form of malaria in Uganda, a worrying sign that the top drug used against the parasitic disease could ultimately be rendered useless without more action to stop its spread. Researchers in Uganda analyzed blood samples from patients treated with artemisinin, the primary medicine used for malaria in Africa, in combination with other drugs. They found that by 2019, nearly 20% of the samples had genetic mutations, suggesting the treatment was ineffective. Lab tests showed it took much longer for those patients to get rid of the parasites that caused malaria. Drug-resistant forms of malaria were previously detected in Asia, and health officials have been nervously watching for any signs in Africa, which accounts for more than 90% of the world's malaria cases. Some isolated drug-resistant strains of malaria have previously been seen in Rwanda. According to a study recently published by BMG, giving diabetes drug metformin to women diagnosed with preterm preeclampsia may help to prolong pregnancy. The findings show that pregnancy was prolonged by a week in the treatment group compared with the no-treatment group. But the result was not statistically significant and therefore points to the need for further study. If confirmed by future research, this could have important benefits for both mother and baby. Preeclampsia is a serious condition thought to be caused by the placenta not developing properly. Preterm preeclampsia often leads to early delivery, putting babies at risk of serious disability and death, particularly in low and middle-income countries. The GE Healthcare has unveiled its latest solutions towards supporting the goal of patients getting earlier cancer diagnosis and treatment without the need to travel abroad, so as to reshape the future of oncology to deliver quality cancer care in Nigeria and other West African states. Also included in the solutions package is a specialized oncology center opening this year, which will produce radioactive tracers for PET and CT scans to help deliver enhanced diagnostic care for people across West Africa. The GE team said it is focused on bringing cutting-edge technologies to the region to increase accessibility and provide clinicians with faster access to information and help increase quality of care, particularly in oncology. And the Lagos State Governor Babajide Sanwo-Olu says his administration will provide nutrition support for over 5,000 indigent pregnant women through its Mother, Infant and Child initiative. Governor Sanwo-Olu disclosed this on Wednesday at the launch of the Mich in Alausa, Ikeja, Lagos. According to the governor, the Lagos State Office of Civic Engagement has been mandated to coordinate the nutrition initiative. And a gynecologist, Prosper Igweli, on Wednesday advised pregnant women to go for an ultrasound scan early to detect congenital disorders for proper management. Igweli said that congenital anomalies, also called birth defects, could be defined as structural or functional anomalies that occur during intrauterine life. According to him, congenital anomalies are birth defects, congenital disorders or congenital malformations, which conditions develop prenatally and may be identified before or at birth or later in life. He said that an early ultrasound scan, especially in the first trimester, would help detect any congenital abnormalities, which could occur in any conception. The gynecologist called for the creation of more awareness on the issue of congenital anomalies. As such, would help the women address the problem early. And this is TOS Television Network, and you're watching Health 54. Welcome back. According to figures released on Thursday by the Nigeria Center for Disease Control, 15 states and the Federal Capital Territory reported 377 new cases and 2 COVID-19 related deaths. According to the agency, that 377 new cases were recorded from the FCT and 15 other states. Lagos recorded the highest number of new infections with 70 cases, FCT 67, Kaduna 38, Edo 36, Rivers 28, Delta 23, Kwara 22, Ondo 18, Plateau 17, Oyo 16, Benue 12, Ekiti 10, Gombe 8, Kano 7, Imo 3, and Jigawa 2. The health agency said that 377 new COVID-19 infections have brought the number of confirmed COVID-19 cases in the country to 203,081. However, 191,601 COVID-19 patients have recovered and have been discharged in the country, the agency stated. And U.S. President Joe Biden addressed the COVID-19 summit of world leaders Wednesday with a promise to donate a historic extra 500 million vaccines to countries struggling to overcome the pandemic. The pledge from Biden at the summit held virtually from the White House brings the total U.S. commitment of donated vaccines to 1.1 billion, more than the rest of the world combined. And the National Agency for the Control of AIDS, NACA, has tasked government at all levels to avoid neglecting diseases like HIV and AIDS, which it said was still an epidemic and has neither vaccine nor cure. NACA made the call on the heels of government's full attention at the curtailing the spread of COVID-19. The Director General of NACA, Gamboa Liu, who spoke in Jalingo during a courtesy call on Governor Darius Ishaku, pointed that despite the significant progress made over the years to reduce the prevalence of HIV and AIDS, government should not be distracted by the current pandemic. He noted that effort should rather be geared towards complementing the gains recorded by ensuring that stigmatization of carriers is stopped and HIV and AIDS patients have access to quality health care. And Kano State has so far recorded a total of 11,475 suspected cholera cases from March to date, with no fewer than 329 deaths. The State Disease Surveillance and Notification Officer, Suleiman Ilyasu, disclosed this on Wednesday during a media sensitization on COVID pandemic and cholera outbreak. He said the cases were reported across the 44 local government areas of the state. Ilyasu said 31 cases were still receiving treatment from 3 local government areas as of Tuesday, September 21. The officer disclosed that Sumela local government had the highest number with over 2,000 cases. According to him, Bichi and Gwazo local government areas were second and third in the prevalence, while Kunchi and Dala local governments have the least number of cases. And District Health Authority have said that the Enakulam have so far reported 20 cases of mucormycosis, commonly known as black fungus. 8 among them have died of the infection. Among those who were infected, 10 were Enakulam natives, while the rest were from other districts. Sources said currently no patient is undergoing treatment for mucormycosis in the district. Meanwhile, according to the latest analysis submitted to the district administration on September 20, the pandemic has infected 14% of the population in the district. The report predicts that TPR will rise due to the changing patterns in tests. Among the 4.1 lakh cases reported in the district in the past 7 months, 7,987 were breakthrough infections. And that is how 54 right here on your Digital First Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.